The question of how primary care looks after homeless people has been floating around for years, and it's good that we're starting to see some research. I think one of the biggest things that affects primary care, as Camilla was saying, is attitude and ethos. I think we can build all the systems we want, but if the attitude is wrong, that plays through the whole process. And so for me, it's less important whether a service is a specialist or a generalist or got an amazing title as to the people leading it care. If the people leading it care, they will find solutions to the problems that they see. And I lead a primary care organisation that's a CIC in Manchester. We have 11 practices. We're not super specialist in anything apart from general poverty. In Manchester, unfortunately, more than 50% of people live below the poverty line. Most of my patients struggle, of which a proportion of them are homeless. We also have over 50% of people in the UK are children who are homeless. And we talk very little about our under-16s and our families. Those families are hidden in plain sight in general practice, and we need systems that look after them as well. The other thing is, it's an amazing privilege to be a nurse or a doctor or a receptionist in primary care, and we need to remember that. But it's not about a single disease. Primary care is never about a single disease, and even if I diagnose your COPD and your depression and give you 75 medical labels, if I do not treat you as a person and integrate and have hope and trust, that care will be poor. There's lots of things we can do in primary care, and the primary care landscape is changing massively. We can have an ethos stand. We can use our incentives. There's hundreds of incentives in primary care with QOF and IIF and PCNs and LESs and DESs, and primary care is good at acronyms. They're all different ways of paying for different targets, basically. We haven't seen a target for how you look after people who are homeless, whether that's homeless single people or homeless families. It would be great to see that either as a national enhanced service or a local enhanced service. It would be brilliant to see something positively written into PCN frameworks. My concern about specialising is that most people, that might mean normal primary care washes their hands of them. And I think the benefit of primary care is that we should be caring for everybody, and we should be passionate about everybody. And if you have a specialist service even a couple of miles away from where you happen to be living, that's a long way. And I want your local practice to be skilled, to be passionate, to be equipped to look after you wherever you live. And I think that's Camilla's vision. The politics is tricky, but we have to remember that leadership counts, and it's about how we lead. I really want to see general practice change, where we talk about the beauty of being a GP, the honour of being in primary care. I want to see people coming into GP land not telling me that they don't want to work night shifts anymore, but because they're passionate about continuity and cradle to grave. And I'd love to see the college lead on that, because that is the doctors of the next generation who will be looking after all of us in the future.